Our teams have been crossing paths in hallways within health systems, and we're finding that more and more health systems, the same departments use the Findhelp platform for helping patients with their social determinants of health, as well as AIDA for the clinical post-acute placements. We're excited to merge those efforts and help social workers and case managers think about the patient's next level of care without these silos between post-acute care and SDOH.
Forget about business and forget about companies for a moment. When we think about the patient or the person that needs help, their life isn't siloed. They might have a food need or a financial need, and at the same time might be trying to help place a relative into a long-term care type facility. And so they're looking to solve those problems in a consistent and collaborative way with their caretakers and their care navigators. And at the end of the day, there'll be a lot of software platforms out there that are helping. But unless we collaborate and kind of reduce the software competition in this space, we're never going to holistically give a good experience to the person.
We admire the business model that Findhelp has, and we feel like there's a lot in common. And so combining the two just makes so much more sense when we think about the person at the center of the process.
The person deserves choice in what post-acute facility they should select for their loved one. And likewise, they deserve dignity and knowing all their options for social services. And I think we're both aligned. Part of what our partnership is really going to, support and offer is a much more unified or even integrated experience of both of our networks into electronic health records, case management systems, and beyond. And I'm really excited about that. I think it's going to make the lives of those users helping people much easier. We're reducing the technical burden, the implementation cost, the onboarding, time and cost for many of those large hospital systems and plans that want to do this work together.
You hear often that healthcare is expensive and the outcomes are not always great. We cannot solve everything, but removing the silos and combining our joint networks, it brings us back to thinking about a person, not just as a patient, but a person as a whole. It significantly reduces the overall cost of care. And more importantly, it brings us to a position where we think about the best outcome for the person that we can jointly deliver.
Thank you, Julian, for coming. It's wonderful to host you here in Austin, and look forward to what we can bring to the communities we serve.
Thanks for having me. I'm really excited for our joint work.